So I always ask this question, how were things, before you started working with us in our program, your condition and how it was impacting your life?
Okay, first of all, as I told you on our first conversation, we were lost. This is
Mhm.
not a well-known kind of, issue, condition with children, FND. Only until we found out from the doctor, who is a visiting professor from Canada, that we went to search the net, YouTube and everywhere to find, something to connect with, some place to connect with, some group to connect with, some health provider to connect with. And we found you because before she was diagnosed, we were like judging whatever diagnosis comes, and you try to connect one. Oh, she has something like epilepsy, she might have Parkinson, unsure answers, or lost kind of prognosis or diagnosis.
Mhm.
Was she having depression? Was she, wrong path? So since you accepted us in the academy and in the program, at least we were guided from a simple hand tremors to worsened seizures, passing out or something. At least now Hazel is able to cope up, and it shows only in a certain time. And I hope it's not a roller coaster ride. It's going to be a super flying to the moon kind of treatment and recovery, straight and nonstop. This is what I'm really praying. And we were really trying to guide Hazel, like follow, at least do the practice of your coping up skills, finding out the correct strategy to overcome. But even Hazel until now is, you know, unsure of what is her real trigger. She can see the warning sign, but what is the trigger? This is even me. I can see that. I see Dr. Jean from having some medical medication for psychotic drugs to getting out from it. Like it makes us so relieved that it stopped there, and it will now be the recovery journey of Hazel.
You've gone
And
through a lot.
yeah, we did. From
Yeah.
wheelchair to what do you call this? Your cane to school. And
So
finally now she's
Hazel,
good.
yeah, absolutely. So now turning into you, what was it like for you to have all these symptoms, before we started working together?
For me, it was so sudden. It just came out of the blue for me when I started having the symptoms. And when I was brought to the ER, I was really worried because um when they saw me, they already said like, "Oh, he's having seizures," and lots of thoughts were going inside my mind, and then multiple diagnosis and like check diagnostic tests were done on me, MRI, and then I had to even transfer to a different hospital to get like a better MRI scan. And as it went on, I had to stop school for a while, which is hard for me because I'm not saying I love school, but I'm a bit of a overachiever, and I don't want to be held back. So it was difficult for me having the symptoms because I started questioning myself if I really knew who I know what I feel. If it was really real, because when I was brought to the doctor before, even before the ER, it was like the day before I was head to the ER when I had like my non-epileptic seizures. The doctor that I went to already like said like, oh, maybe you have panic disorder. So she already diagnosed it, and that was already her hypothesis that I had that. And then I go to a different doctor, they have another diagnosis, and then I have different doctors who give me another diagnosis. I was going doctor after doctor telling me different things. And then some were even asking me like maybe you're just super stressed, maybe this is just your body saying that you're stressed. But I think it was different for me thinking like it was stress because I couldn't walk, I couldn't like move my arms, I couldn't do simple stuff at school. So it was difficult for me. And sometimes I would catch the attention of my classmates during class because sometimes my hand would jerk or sometimes I would bang my hand on the table by accident from my jerking. Finally, my mom was doing a lot of research because it took us 3 months before I got diagnosed with FND with my doctor in Cardinal Santos here in the Philippines. So my mom was looking up on YouTube, you know, like looking for what is FND, what are the symptoms of FND, what can you do for FND. And then she stumbled upon one of your videos and it gave my mom clarity. And then it gave my parents also clarity. And it was difficult for them during that time because they they were in a different country. So my mom had to fly over. So when they found that video, it gave them a sense of clarity and my me thinking it was impossible because we were in the Philippines and then you were based in the US. I couldn't think like she might accept us because my mom said, "Oh, I'll email her. We'll try to email her because she seems like she's the only one who has the answers right now for us because most of the physicians here, only one out of like the five physicians we went to knew what FND was." Since she was based also in Canada, who she was dealing with these types of cases before. And she couldn't give me a recommendation because during that time she said like it was new to her. So she gave me to a psychiatrist. And when we finally contacted you, and then my mom said, "Oh, she wants to do like a interview to see if we can be accepted to the academy." So it was surprising to me because I didn't really expect that they would reach out because it's impossible. Like you're all the way in the Philippines. Like it cannot happen. It's not possible. So when we're already finally there, we woke up like early in the morning just to have the interview. That's when my mom and I started being hopeful. She said like before we entered the call, like, I hope this is finally our answer to our problems because we've been looking for solutions for months now and it feels like it's been getting harder for both of us and I don't like seeing you having a hard time already just living in general. So when we had the interview and after that we already felt hopeful that we found the solution to our problem. And when you reached out and said like, "Oh, you're accepted to the academy," my parents immediately thought of ways to get into the academy and really try to find some money just to enter the academy. And with the help of also my sister in the US, I was really thankful at that time because when I first had my meetings with you and I was joined with also the teens, it's difficult to explain to people what you're experiencing, though you have like your family and your friends to explain like, "Oh, I'm so frustrated because I have these symptoms, I can't do this, I can't do that," or "I have symptoms and it's frustrating to me," or "It makes me feel sad," or "Sometimes I'm lazy." People may sympathize with you, but they won't understand what you're going through. So I think it helped a lot going through that and then ask people with you telling you that they relate and they're like, "Oh yeah, I have this too," and then they give you like what they do. And it's like having like a really close friends that can give you advice on things that that you don't know what to do with. So yeah.
That's amazing. Yeah. I am so glad that it's working out time-wise. I know it's not convenient hours on your end, so I really appreciate that. And a lot of families are going to watch, this kind of, what your experience has been. And so can you tell us a little bit about how you have transformed since you started the program from both of your perspective? Let's start with Mary as a parent.
Previously, I was that erratic and uncontrollable mom who doesn't know what I'm supposed to do, like been worried, anxious, like I'm under stress. I felt that I grew a year older for just a couple of months, running to health providers and doing the tests and everything. traveling from one place to the other, being with the children. But thank God, after joining the parent coaching and going through the modules and trying to understand what can fit her, following here and there a little of not so nagging, but convincing her to continue on doing your exercises and coping up skills. I feel more relaxed because it seems like I'm the one having FND. I'm doing it too. I feels like I'm doing the coping up strategies. So that I be able to, go day by day. And it's really FND is something to be thought of like just the now. Do it day by day, until you feel that everything is back to its place. So I think I have grown better being sort of a caregiver, stroke remote caregiver, like what I am now. I'm far off. So thank God Hazel has been cooperating and she's doing well.
Mm-hmm.
Today she's going for her exams, and at the same time she's rushing. She got her license, driver's license already. So she's driving too. Yeah.
Oh, so
Yeah.
happy for you.
Yes.
Okay, Hazel. Yeah. What
Yeah.
about
Fastly
you?
so.
I think for me at the start of the program, if you were to ask me like, do you think you can do the things like what I'm doing now? I would have said like I couldn't even imagine myself going through with it, because even like the psychiatrist I had before, she was telling me I should consider like changing my field. And I think I found myself questioning myself and my abilities to do things. So I was thinking like, how can I be a nurse? How can I go through school when I can't even take care of myself? How can I take care of people when I can't even take care of myself? And my parents before were like dreaming of me driving and then like doing a lot of stuff, and I couldn't even imagine, like I already had that implanted in my head na it's not gonna happen. Like I was already accepting that I wasn't able to do the things that I already imagined I would be doing, like doing things alone. I always have to have someone with me to make sure I'm okay and make sure that person that I'm with knows what to do in situations I have. At first, when I had like the coping skills, like PMR and like all these other suggestions, and at first I was a bit skeptical because I couldn't really implant it in my brain, saying like, oh, breathing can help, reduce my seizures. It sounds a bit silly in when you think of it that way, like, oh, how can breathing already help you, or how can progressive muscle relaxation can have help you in having your seizures or coping up with the triggers that you have. And I had a clinical duty at the OR. So I was standing and I was having my trigger because I was tired, because it was 4 a.m. and continuously I was going to school at like 5 a.m. and then leaving school at 6 p.m. So during that day, I was having my symptoms. I could feel it, like it was coming. And then when I did feel like it was there, I started doing my PMR and my deep breathing exercises. And next thing you know, I was already able to complete a 4 hour and 30-minute surgery as a scrub nurse. So I think that's when I knew like I've really changed a lot with my mindset, because I already do it as soon as I feel it. Before, I would just let it happen, and then that's when I do it. And at first my mom would tell me, oh, do this, do your PMR, do your, and then I was like, no, like I don't I don't want to do that, because it sounds really silly. Because how can it help me before? And then now that I think I changed my mindset towards it, seeing also the people in my batch also before, and even the people on, the other teens that went through it, it was, nice to see that it helped for them. So it gave more motivation for me to do it, and already convinced me. And so even now, like even if I don't have the symptoms, sometimes I still do it. It helps also with like even like when I feel like I'm having stress, or when I feel tired, because I know that's one of my triggers. So it just really helps a lot, and it helps to me day to day to function properly. Before, I would get my symptoms like almost every day. I had like, I know it's it's Dr. Jean's thing that you don't count how many times you have it. But before I was just making sure like, oh, I don't have it. That was my goal before. But I think now my goal is just to really utilize the PMR or the deep breathing exercise that I have day to day. So now, like, basically I don't have it anymore as much. Like, just maybe once a month or maybe none at all in a month. And it just makes me happy because I was able to get my driver's license, which I couldn't imagine doing before. I was able to go a concert by myself with my niece without anybody, like an older adult, having to watch me. And then I'm able to go to clinical duties. I'm able to participate more in class and really try to help out in class. I'm even called by the dean of nursing sometimes to host for their events because seeing that now, it just makes me happy because it sees that I can see that people can depend on me again, because before I felt like nobody can depend on me because they were being very careful with me. But now I could see like people, I'm even the leader of my clinical rotation group. So it's just
Oh, wow.
surprising to me that I'm even in this position already.
Wow. That's amazing. The life that you couldn't see, almost a year ago. Yeah. Oh, wow. That's amazing. Very inspirational. And last word, Mary, what would you say to other parents who are watching this video, who are thinking about what to do, whether to join a program or not? What would you say?
Yeah. First, if you really are determined to find a resolution or improvement or probably the removal of FND, number one, you have to learn what FND really is. That's the most to understand it and to be able to accept it and to be able to try, cope with whatever you are being taught of and never give up. Never give up because I still believe that it is a condition that can be gone, not just resolved, but gone, gone forever. Yeah.
Very possible. Yeah, great. What about you, Hazel? What would you say about teens who are thinking about this program?
So I think that people who go through this program, like teens who are also going through this, I think people need to realize also that teens who are going through this stage in their life, it's difficult because they're teens right now. So you're still discovering yourself, and then you have this type of disorder that comes into your life, and it's difficult. But I think the most important part is just to have trust and patience and honesty, because you have to be patient with yourself and don't make it too hard on yourself. I would say, because when you make it hard on yourself, it's difficult to accept that you are trying, you are doing the best you can, and the symptoms may come back. There may be new symptoms that may come back. Sometimes they get worse, and then you start to think like, oh, it's never going to get better. But I think you just have to give it patience, and you have to put your trust on the things that you can do and what you are capable of, and you have to give yourself honesty that you are doing the best you can, and you have to be honest about to the people around you, because there were times in during the program I started like hiding sometimes to my parents. Like, I had episodes which was wrong, even it was like the simplest episode. I think it wasn't worth mentioning to my parents or my family, just to not give them any worry. But I think that's what's important as well, because you're not really going through this alone, but also your family is your greatest sidekick in this type of situation. Your parents are there for you. So you have to be honest at all times, and you must put your trust on them of what they think is best as well, because it may feel like you don't know everything and they don't know everything because it's also their first time. But I think you have to put your trust in each other, because you're both going through this together and it's not a one-man job. So yeah.
Absolutely. Oh, that's beautiful. Anything else you feel like, other people should know about the program? I mean, you shared so much.
Well, most people whom I meet, when things are discussed, such as, certain hand tremors or something, I told them, I won't give you the name of the doctor, but I would like you to go and visit YouTube, look into the videos, see if you find Dr. Jinsley's name, and try to communicate with them. learn if it matches your expectation or matches what you're having right now. Try to get in touch because, you can get in touch with her. It's available in their link. So those are my recommendation, most especially. Actually, our neuro doctor who diagnosed Hazel, when we told her, and the psychiatric doctor too, he was asking for your name and the link where they can go through. Probably along the way, you will encounter them, Dr. Jin, people that we are referring to. And hopefully, Teen Academy will grow stronger and kids will be okay. Parents and families will be back to its normal life. Yeah.
Amazing.
Yeah.
Hazel, any one last word?
I would say that it may seem complex at the first time for people to hear about FND, and finding someone who really knows what they're talking about is really difficult to find, since FND is not really prevalent in, like, even in my country, it's not even prevalent. When I explain it to people, they think like, oh, psychiatric problem, or it might be neurological problem that cannot be fixed. But I think the Teen FND Academy makes it simple. So for something so complex, it makes it simple, which is helpful to families because it's already so complex. So having like the academy help you make things so simple and make it easier for you to understand and really cope with the things that you have. It brings a sense of relief because you think it's so complex, but it turns out it's simple to do, and it's simple to find the solutions to it as long as you really follow and really understand what you're doing and why are you doing it.
Yeah, absolutely. Well, thank you so much, both of you. And this is going to really help other families, get inspired and have hope more than anything. So you're the living proof. Thank you.